is this really the best of times to be living in from a global health perspective? And we think the answer to that is pretty simple. It depends on where you're living. I mean, one statistic that has gotten a lot of attention recently, partly because Bill Gates has spoken about it and tweeted about it, is that from 2000 to 2015, annual child deaths declined from 10 million per annum to 6 million per annum. That is extraordinary. We still lose 6 million children a year. We lose 1 million children on the day of their birth and 1 million more in their first week of life. So while if you just kind of think about goodness, there's been a 40% decline. Isn't that extraordinary? Yes. But as mothers of 2 small children, I don't want to be on the other side of that statistic. And we don't think anyone should be. So while we still have enormous work to do, we also do recognize that the world has made real progress. To end on a slightly more optimistic note, we conclude our book with the lessons of the Global Polio Eradication Initiative. Started in 1988, a real coordinated effort catalyzed by the WHO, but in partnership with a number of other institutions, both funders and kind of on-the-ground partners. It is, I think, at this moment in time, easy to focus on the fact that we still have polio cases in the world, despite now almost 30 years of concerted effort. But over those 30 years, more than 3 billion children have been vaccinated against polio. More than 20 million volunteers have been mobilized, and the work has taken place in more than 130 countries. So that is fairly extraordinary. So yes, we have work to do, but we think the moral imperative is so strong because we have proven what can happen when we do focus and mobilize appropriately.